There are a lot of biomarkers that are currently being explored for bladder cancer, but biomarkers really aren't being used widely. And the goal of the talk was really to focus on patients with clinical T1, T2 disease and try to see if we can predict which patients have non-organ confined disease or who would respond to chemotherapy. And there are a lot of problems in bladder cancer because we're not really able to stage patients very well clinically. And so a lot of patients who we think are organ confined really have non-organ confined disease. And there was a large study from the Bladder Cancer Research Consortium that had about 800 patients and found that even though the patients were thought to be clinical T1 or T2, about a quarter had positive lymph nodes and about 40% were understaged. And when you think about who should get additional therapy rather than just removal of the bladder, you really are thinking about patients who have disease outside the bladder. So those patients are patients with positive nodes or patients whose cancer is extending through the wall of the bladder into the fat or into other organs. And so there really aren't good clinical predictors. When you resect the bladder, you don't want to cut a hole in the bladder, and so we rarely know if it's really invading through the wall of the bladder. And imaging with CT scan and MRI really aren't accurate enough to know if somebody has positive lymph nodes, and really isn't good enough to know if you have extension through the wall of the bladder. And so the hope is that biomarkers will provide some additional information. There have been a couple of studies looking at immunohistochemistry at a panel of biomarkers, and a relatively small cohort, but we're able to find that a panel of markers did predict greater likelihood of extension through the wall of the bladder. We recently were involved with a multi-center cohort of over 200 patients, and we used subtyping to divide the patients into luminal and non-luminal subtypes. And we found that the non-luminal subtypes were almost twice higher chance of having non-organ confined disease than the luminal subtype. And we looked at the TCGA over 400 patients and found the exact same thing. And so now the hope is that if we can validate that, you'll be able to identify patients who really should get additional therapy rather than just cystectomy alone.